All right. Good evening, everyone, and welcome to ATP Live Monday. How's your day been? I hope you've had a lovely day. Okay, so welcome. If you are just joining us and you're wondering where you're on ATP Live Monday. This program is brought to you by Hacks the Pediatricians Foundation. And so let's just start by sharing the videos and making sure everybody can see us and they can hear us. So I'm going to just do the same, and I want you to help me. Let's just share the video to everybody. Where am I? Okay. Okay, I can see myself on my. I hope I'm live. Okay, I'm live. Okay. All right. So I'm just going to pin the post and then share the videos to all our groups. Welcome to ATP Live Monday. Okay. All right. Then now, what else I need to? All right. Welcome everyone. Okay, so thank you so much for joining me. If you are just joining, I'm Baby Boy there. You're on to Ask the Pediatrician Live Monday. This is a program where you get to ask any questions that you may have about the health of your children, and you get immediate answer live from a pediatrician. And so I'm going to be here for the next 1 hour and then trying to answer all our questions. I'm just trying to share the video to all the groups and trying to pin them. And after that, we can start. I hope you've had a lovely Monday. Busy. Mondays are actually busy, but I'm glad to be here to address our questions. Okay, so I think I'm done with all the sharing. I just need to do a little bit of the pinning and then we can start to answer the question. But if you have any question, you can start to post your questions directly and then we will answer them. Um, Remember to start with the age of the child and then a short summary of what we think is relevant, and then you can now ask your questions. Try and keep it short and simple. You don't need to tell us the entire life history of the child. Yeah, and then just keep it short and simple, and we'll try to answer them. All right. Oh, Major Evans, good evening. Welcome. I'm happy you are able to join us today. All right. Good evening, everyone. And let me now formally welcome everybody. Good evening. Welcome to ATP Live Monday. I am Miss Boyde. I'm a pediatrician, and it's my pleasure to be here today on ATP Live Monday. This program is brought to you by Ask the Pediatricians Foundation. We are your number one partner in raising healthy children. We are here to support you with health information, health education, all your information you need on how to raise healthy children. And we are committed to the health and to the welfare of all children globally, and especially in sub-Saharan Africa and especially Nigeria, where a lot of our children are still dying from treatable and preventable conditions. So that is what we do on Ask the Pediatrician's Foundation. We do it online, we do it offline. So this ATP Live Monday is just one of our online expressions. But remember, we also have our Facebook groups where you can post your questions Mondays to Saturdays, and we will try and answer your questions as soon as we can. So thank you to those who are already here. Hakim Oladun, Oluwaseifumi, thank you. Oluwaseifumi, sorry. Added additional stuff to your name. Thank you, Funke Horemade. Thank you, Major Evans. So if you have any question about the health of your children, you can just post it now and I will try and answer them. But remember that even if you have questions after the 1 hour live session, our Facebook groups are always open Mondays to Saturdays. You can post your questions there. We have our moderators, we have our other healthcare professionals who are able to support us in answering your questions. So thank you so much. So welcome everyone. Pierre, good evening. Welcome, welcome, welcome. I was going to talk today about the new updates we've had on our immunization schedule, because I just always want to, because people always ask a lot of questions about immunization. I just want you to know that immunization schedules change from time to time, and I always want us to know that we on Happy Pediatrician Foundation, we are always there to support you in updating you with the new thing. And I've posted the new schedule according to the National Primary Health Care Development Agency, and we've posted the news NPI, what we call the Nigerian Program on Immunization Schedule. After we've posted that, a lot of people have asked questions, and I think it's because many of us don't read the fine prints on those then. But I'm going to try and also talk about it today a little bit, and it's really the fine print on that schedule. And I do also get a lot of questions from people about our private hospitals and the immunization schedule that they do, and some of you ask, so should I give maybe flu vaccine? Should I give this? I've always addressed them in the past, but I will still address them today. So, in as much as I'm answering your question, I'm going to be taking a little bit of time to address the NPI updated vaccine schedule for Nigerians. Okay, so if you're not in Nigeria, no problem, but feel free to ask your questions and I will answer them. Okay, so I think I'll start with answering the few questions that have started popping in already on Facebook. Miriam Raymond, my twin boys of 4 months plus. I noticed that recently the diaper sadly gets full with pee. Is it normal? Okay, so you're giving us the weight and the age of the babies. Okay, thank you, Miriam. So again, this is another very popular kind of question that we've addressed multiple times, but I will go over it again. There are many factors that affect urine production and what even mothers perceive as urine outputs by the babies. Okay, so let's start by saying, of course, the child has to drink. And for your twin babies, we expect them to be on breast milk. And that is where the food and the water, everything is coming from. And as long as babies taking milk, they are going to produce urine. Okay. Now, the body has what we call a system homeostasis, in which there's a particular amount of water that should be in our body, for the body to do all its work. So what the body does is that it will try and take all the water it needs, and after it has taken all the water it needs, whatever is left is what is passed out as waste. Now, excess water that is passed out as waste is passed out in urine, but that is not the only way the body get rid of water. Water can also be get rid of in sweat. Okay, especially during the hot weather where we the body's temperature tends to rise and the body is also trying to cool down. And the way the body cools down is by making us to sweat, and through that sweat there will be some evaporation and our body will cool down. So water can also be lost through sweat. So there is a lot of check and balances in the body about the amount of water you take in and the amount of water that is taken out of the body. So if your child's urine is a little bit reduced, the first thing is, are they taking enough of fluids? For breastfed babies, we want it to be breast milk. So if the children are drinking enough milk, they will produce urine. Then number two, the weather situation. Is it hot or cold season? During the hot season, the temperature is high, there's more sweating, so children tend to lose a lot of water in sweat. So when the body is losing water in sweat, the urine is the final points at which the body tries to conserve water. So the amount of water that will be passed out in urine will be reduced. So even you as an adult, you will notice that during the cold season, you tend to wee more often. If you drink the same amount of water, you will wee more often during the cold season. Whereas during the hot season, your urine output will be lower. That is another thing. So you need to take note of that. What kind of, depending on where you live and how is the weather situation. And another thing for babies, is very difficult for you to really say how much urine they are making because it's going into the diapers. So and some diapers, depending on the effectiveness of the diapers, some diapers are so hyper dry. So even when the child is making urine, it will look as if it is still nothing much is in the diaper. So we can't rely on how heavy or how wet the diaper is to decide whether a child is making urine. So that is another thing. So if you suspect your child is not making enough urine, the first thing you want to do is to actually take the diaper off and actually collect the urine itself. Okay, and we actually measure it. Okay, so we collect it into a bottle. We actually quantify how much urine the children are passing, maybe over 6 hours, over 24 hours, and then we can now say how much urine are they making mils per kilo per hour, and that is what will tell us whether that is enough or not. Okay, and then we also want to be sure that you're also giving enough fluids for the children. Okay, so as long as, for me, most of the time, as long as the child is actually making urine, and even though you are not sure of the quantity, but you need to be changing the nappies, that should be okay. All right. But if you are not seeing anything at all in the nappies, like it's completely dry for like 6 hours, then we will be worried about that. And most babies, once you breastfeed them, within 30 minutes of that breastfeeding, they will pass urine. So what I normally tell mothers is that just leave the diaper off, breastfeed them, and watch out for them making urine. Actually, for the boys, you can see them passing urine straight away. And then look at the color of the urine. If the color of the urine looks a little bit dark, what we call concentrated urine, like it looks deep yellow or something, that means that the quantity of fluid the babies are getting is not enough and you need to increase it. And but if it looks light color, like colorless water or light, very light yellow, that is normal. Okay, but if you're not sure, obviously your doctors and your pediatricians are there. While I'm on that question, somebody posted a question yesterday in the group, and it was a Sunday. We don't allow people to post on Sundays, but these were like leftover questions from Saturday that we've not finished, so I was able to answer some of them yesterday. And she was trying to tell me, oh, our baby, when she's breastfeeding her baby, the baby doesn't make urine, but when she gives water, the baby will make urine. And I was like, no, that is not possible. There are some things that are not compatible with science, no matter how much you tell us. It's not compatible with science. Okay, there's no reason why a child will only make urine when you give them plain water. If you want to do water and breastfeeding, just come out and say that, but try not to hide it under your baby is not making urine, because I was explaining that post that breast milk is 70% water. So if your child is getting 70% of water from breast milk, why would the child not make urine? How the quantity of water you are now giving, it may not even be up to the 70% that is in the breast milk, okay? So why would the baby just make urine only when you give plain water, and then baby will not make urine when you give breast milk? So I know people look for a lot of excuses for doing water and breastfeeding together. There is no excuse. Even for those who live in the northern part of the country, even for those who live in the deserts, like hot deserts and very hot, and those who live in the northern part of the country know what I'm talking about. Even in those places, we still don't recommend that you give your babies water in the first 6 months. It is still breast milk, and science evidence has shown that even with the breast milk, your babies will not be dehydrated and they will still get enough water, okay, to keep hydrated and to make urine. So there is no justification, there is no excuse anybody can give. If your child is not making urine with breast milk, that child will not make urine with water, and that means there's a problem with the kidneys, and that is what we should be looking at. There is no magic that plain water will make a baby to pass urine and then breast milk will not do the same. There is no magic anywhere. So like I told that mom, if you are with me, what I normally do is I will keep your baby with me for the next 4 hours, take off the nappies. If it's a baby, we can put like a little bit of glove around the penis and just tie it there. And actually want to measure the quantity of breast you're giving your baby. And I want to see that baby make urine in 30 minutes. That baby will make urine no matter what. And then I can measure it. Okay. For the girls, it's a little bit complicated, but we also have urine bags for girls as well. So we can always do this thing. It's not complex at all. So that is what doctors will do. If you're worried that there's no urine or it's not enough, just bring baby to us. We will have to feed the baby and we will actually collect the urine and we can measure it and we will be able to tell you this is the mils per kilo per hour and that is enough. And we tell you if it is not enough as well. So we don't rely on how heavy the diaper is. Those are what we call subjective. But when you actually collect the urine and measure it, that is the objective evidence that a child is making enough urine. So I hope that is clear. I decided to go into details in that question because somebody else has asked similar question around, and I don't want mothers to start panicking about urine and all that. Actually, for babies in diaper, you need to actually take off the diapers and actually collect the urine before you can comment about that. Okay, so we'll clip that and let's move to the next question. Piel Chieke you say I want to start giving my 5-month-old daughter formula. I want to start with pick B0 to 12. Hope the pick is good. I don't know why you're whether you're asking for my opinion. I don't have any opinion about any formula. I'm going to tell you to give your baby breast milk until 6 months. If you want my professional opinion as a pediatrician, my opinion is you should give your baby breast milk until 6 months. That is it. That is the professional pediatrician opinion. If you think there are any other reasons why you cannot do exclusive breastfeeding for 6 months, that is something we have to talk about one-on-one, okay? And then that is when your doctor can now prescribe for you a formula. Babies taking formula is not a mother's decision. It's actually something that should be prescribed by a pediatrician for specific reasons. We don't just ask people to give formula. What we recommend is that you should give your baby only breast milk for the first 6 months. Of course, I don't know, it's not a law that we're not going to arrest you for giving your baby formula. So, but if you want me to give you a professional opinion, that is what I'm going to tell you to do. You have not told me any reason why you want to give your baby formula. Okay. And most of our reasons, there are only very few reasons why a mother cannot breastfeed her baby is if the mother is not there at all, or mother who is on chemotherapy drugs. Those are the only few two reasons really why a mother would not be able to give her baby breast milk. Every other reason they are subjective. Oh, I'm not lactate enough. We can help you to lactate enough and give you a baby breast milk. So, or maybe mothers that have multiple, sometimes you say, oh, my 3 babies, people breastfeed twins exclusively. That one is not difficult. Maybe by the time you get going to 3 or 4, mothers start to like it's much. Yeah. But otherwise, most of the time, we are always just looking for what look like the easy way out at the beginning, but it's not the best way out at the end, because you sometimes we're trying to save, oh, I'm trying to just have an easy way out. But when we start formula feeding, your baby's risk of getting infection, diarrhea, respiratory infections is higher. At the end of the day, you end up coming more to see the pediatrician for all those health issues. We end up having to treat those ones. At the end of the day, you may actually get yourself more stressed up taking your baby for illness and all that than if you have actually stuck with breastfeeding. So that is a thing. And we would not recommend any formula. Pediatricians are not supposed to be discussing formulas even with you, unless, like I said, you are seeing us a consultation and we want to prescribe, So, but I'm not going to tell you, oh, this particular formula is better, this one is good. No, I can't do that with the mother. That is also against the breastfeeding code, So that is why you don't see formulas being advertised on TV. There are lots of laws that guide all these things. So, and formula makers are not supposed to talk to you as well as a mother. They are not supposed to advertise to you as well. So, for many, many reasons, which I think I've also addressed in the past. So, that is just my professional opinion. Yeah. Okay. All right. You just have 1 month to go. You can do it. Okay, Omalala, Sonia, Omotola, sorry. You said thank you for all you do. My boy is 4 years and 3 months. Yesterday complained about hair pain in the right hair. I checked and saw a white star, which I gently pulled out. What did you see that you were pulling out? Is this something the child puts in the hair, or you just saw something and you pull out something? Don't do that. This can be very dangerous, because I'm not quite sure what you're seeing and what you're pulling out. In medicine, we have what we call first do no harm. We have some principles or some what do you call it? Like some ethical principles. In other words, if you are not sure what is going on, don't make it worse. Don't do anything. It's better to do nothing than to do something that will be worse. So if I see something in my baby's ear, so unless I'm sure what it is, like let's say I saw an eraser and I can easily get it out without causing any harm, that is when I would do it. Otherwise, for a mother, I would really say don't try to take anything out of your child's hair. It's really dangerous. We don't know whether it's the tympanic membrane or something in the hair that you are trying to take out. That can be dangerous. So next time, don't try to do that. If you're not sure what is there, leave it alone and take the child to the hospital and let the doctors be the one to look into the hairs. We have our own instrument for looking into the hairs. I'm sure some of you have looked, something we call it horoscope or otoscope. It's like it has a little light at the end, and we can actually see deep down, and then we will know what it is, and then we can decide what to do. Okay, so but otherwise, don't, unless the child actually puts something in the hair that you are sure you can identify what it is. And even for that, you should be careful pulling things out of baby's hair. It's better to see the doctor to do it for you, to avoid causing more harm. And you don't need to put an olive oil in the child's ears just because the child complains of pain. Okay, if the child has pain in the hairs and you can see like wax, thick wax, which should be brownish or yellowish brownish, that is the only time you're allowed to put olive oil in the child's ears. Whenever we say do something, there's always a reason for doing things. We don't just do things blindly, like just do it for doing sake. No. So the reason why we put olive oil is to soften thick or hard wax so that the wax can flow, hair wax, so that it can flow out. But if it is not wax that is thick and hard and cannot come out, there's no need to put olive oil in the child's ears. So if this child is still complaining of hair pain, I really think you should get a doctor to have a proper look. I'm not quite sure what is the white thing you see in the child's ears, because you're not supposed to see anything white. The only thing we're supposed to see that is a little bit white or down the line is the tympanic membrane. It tends to look pink, a little bit pink or shiny and all that. But I hope it's not what you remove, because that is the normal part of the hairs anyway. But because I'm not sure whether your child already put something inside his ear, because boys do it a lot of time. They put things in their hairs and they won't tell you until it start causing problem. Yeah. So if that is what you remove, that is okay. But if the child is still complaining of ear pain, I want to strongly recommend having a doctor have a proper look in the ears. We should be very careful with the ears. We should avoid poking or looking into that hair. I usually don't even encourage parents to look into the hairs at all, because there's nothing you're looking for there. Most of the things that needs to be looked for are something the doctor has to do. Okay, and let's not put stains, let's not use hair cotton ball, let's just leave that hair alone, because the hair drum, the tympanic membrane, is very sensitive. It can be punctured and it can cause deafness. So we really have very careful around it. Okay, so if you are still worried, I'll recommend seeing a doctor for proper evaluation. There are many causes of ear pain. It could be ear infection. It could be many things. So, and then that has to be treated appropriately. Okay, yes, so that's the question I just answered now. Funke Horemade say my son had his 10 weeks immunization on the 10th of the month, and the area of 10th of the month, today is 23rd, so that is 13 days ago. Okay, and the area of the vaccination is hard, not painful. That is normal. That is normal, because what happened is that when we give that 10 weeks or 6 weeks or 14 weeks, it's a deep intramuscular injection. So we expect a little bit of bleeding into the muscle, the thigh muscle where we gave it. So there'll be a little bit of bleeding, and that bleeding will come together and form what we call like some healing tissue, and that is what causes the hardness. But it's something the body will resolve by itself. You don't need to apply ice pack. You can stop the ice pack. Ice pack is when the bleeding is happening in the first 1 or 2 days and it is painful, it's red. That's when we use ice pack. But now it has organized, it has formed into like a cloth, if you like, and it's you don't need to do anything about it. The rest of it is the body going to take care of it by itself. So stop using ice pack. Ice pack, it should not be used more than 2 days, 3 days max. So 2 weeks after, no, we don't need ice pack. And I'm happy it's not painful, it's not red. So just leave it alone. If it's just hard, you just leave it alone. It is those bleeding into the skin that has formed, organized into what we call fibrin tissue and all that. The body will clear them over time. Just leave it alone. You don't need to worry about it at all. It's nothing to worry about. Okay, so Funke is asking, your 7-year-old son has your infection like 3 times a year. Okay. The first time it happened, took him to a teaching hospital. His ear were clean. There were no objects in his ear. What could cause ear infection? Okay, very good question. Ear infections are caused by germs. Okay, most time it could be viruses, it could be bacteria, and all that. And in some children, it can even be things like fungal infection. So most of the time, ear infection are caused by germs. How does the germs get into the hairs? Actually, it's most of the time it gets there through the blood, not necessarily through the hair, like somebody, of course, it can happen through the hairs as well if the child pokes something in their ears. But most of the time, it can be from the blood or it can be from the throat, So because there's a connection between your hairs and your throats and your teeth area, all those, what we call the head and neck area, they are quite connected. So our ears, our throats, they are all connected together. So germs can travel from any of these areas into the hair. So that is how most children get their hair infection. So it can be from blood, it can be from the throat area. Of course, if the child also pokes something in their ears, and cause a little bit of, it can also cause some ear infection. So that is how children tend to get ear infection. Some people are a little bit more prone to having hair infections than others. And it's really for people who already also have some maybe some abnormal shape of the inner hairs and things like that. You can also of the middle hair. Sorry, it can also predispose them to having hair infection. Hair infections are generally common in children. It's one of our commonest infections. But the good news is that most of them are actually due to viruses. And what means is that for viruses, you just give them a little bit of hair pain, but otherwise they're fine. They won't need antibiotics or anything like that. But we do have the ones that are caused by bacteria, and that is when there will be, if especially when the tympanic membrane is, there will be initially some swelling behind the ears, and then later it can burst or rupture, and then the pus will start coming out. You start seeing pus coming out of the child's ears, and those will require antibiotics treatment. So that is and if your child is having recurrent ear infection, three doesn't really, I'm not sure three will qualify as recurrent enough. Sound like we didn't know more, but if it's happening more frequently, let's say 5 or more, then you need to see the ENT doctors, because there may be other reasons. And then some children have what we call chronic ear infection. So it's the acute one I was talking about, where it just happened, we treat it, and that is the end. But some children have chronic one, they always have what we call water in their ears, glue here. And those ones are the ones that tend to see ENT doctors. Sometimes they have to do something to bring out the water in their ears, because that would predispose them to having recurrent ear infection. So that is how ear infection happen. How to prevent it? So like we said, don't do anything inside the hairs. Don't let the children stop putting, don't poke anything in the hair. Immunization. So most of the immunization we give at 6 weeks. So that pneumococcal vaccine that we give, it also protects against ear infection. The HIB, Haemophilus influenza type B, it also protects against ear infection, the bacterial ones. Most of the viral ones, there's nothing you can do. But the good news is that most of those ones tend to resolve on their own. We just give them paracetamol and it will go away. So it's nothing to worry about. Yeah, and it tends to be common in baby children under the age of 5. By the age of 5, most people stop having hair infection, except for those who have that chronic type, and there may be other reasons for that. And those ones are the ones that become ENT doctors' clients for a while. So otherwise, most children will stop having hair infection by the time they're about 5. Yeah, so that's what you can do. And if there's any other infection, like around the teeth, around the throat, sore throat, and all that, we need to get it treated quickly, because if it's not treated quickly, it can spread to the ears and cause ear infection as well. All right. Homiche, good evening. My baby's weight is 7.5 and 9 months. Is it okay? We want your baby to weigh in at averagely 9 kilos at 9 months. So 7.5. That's 2.5 over 3. That is 2 over 3. That's about 66, 70, around 70%. It's a little bit low, but it can be better. It's not that bad, but it can be better. Let me put it that way. Let me calculate the expected versus the. I was just using my mental maths, but let me just use the calculator to do it. So I have exact figures, and then I can tell you whether I'm worried about it or not. Yeah, it's still within normal. It's 83%. So anything 80% of normal is still okay. So it's okay. But I worry that you're already on the edge of normal. In other words, is 83 now. 80 is like normal. Anything below 80 is already abnormal. So I really want it to go higher as soon as possible. It preferably closer to 9 kilos. And that will make us happy. But meanwhile, just make sure you're feeding the child well. Make sure there's no other health issues, and the child should be fine. Okay. All right. Let me just check Instagram people whether anybody has asked questions. Instagram people, no question. Feel free to ask a question. I will come back and take your question. But Facebook people are keeping me busy. Asinuke Bakare, good things, and thank you for all you do. You're welcome. Is it normal for a 6.4 months old baby urine to be thick and looks brownish? Is it 6.4 months. That is a very unusual way to say the age of a baby because we usually just say baby is 6 months old or 4 months old. We don't talk about six, maybe if I thought 6.5, but not 6.4. That sounds very unusual. Or is this 6 years, 4 months old? I really need to know the age of this baby correctly because it's important to me. So just clarify if you are still in the comment section what is the exact age of this baby. Just put it only in months or years. Don't add 6.4. Just say it's either 6 months or 7 months or don't put 6.4. It's quite a bit confusing. Or you can say 6 months, 2 weeks, or 6 months, 3 weeks. That is even better. Okay. Number one, urine should not. We don't talk about thick urine. Urine should be watery. So I don't know about what you mean by thick urine. So we don't use that word thick when we're talking about urine. We talk about thick with poo and all that, but never urine. Urine is watery, is water. So there's nothing thick about it. So that is the first thing. Number one, urine should never be brownish in color. Urine should be clear, colorless, or what we call amber color, but most parents will struggle with the word amber. So it's something like light yellow color. So that is what it should be. There's nothing brownish about urine. Any brown urine is abnormal. Okay, so the urine looks like the color of the pap is taken. No, urine should never be brown, should never be dark colored like Coke, should never be brown, should never be any other color than clear, colorless water color, or at most a little bit light yellow urine. So that is what we expect for urine. Okay. So, but I need to quickly clarify that has to be fresh urine coming straight out of the child's body, because sometimes if you collect urine in diapers and you go and leave it somewhere, it will change color. His the oxygen, what's calling? Yeah, there are some things in the urine that will get changed because of reaction with gases in the hair and all that. So we don't use those kind of urine that has stayed in the diaper for 2 days or 3 days or 3 hours self. So if you are worried about the color of your urine, let the child pass the urine in a clear, colorless container. Like that's our universal bottle, or any bottle, any clear colorless bottle, or even cup or something, or like your all this bottle for water. You can take an empty one and let the child pass urine into that, and then that is the one that we want to see. Okay. I'm not sure whether this is a boy or a girl. You didn't tell us if it's a boy. So if it's a boy, it's even easier because it's easier to collect urine from boys than girls. So just let the boy pass the urine into an empty water bottle. That the one that is clear, like the bottled water that people sell. Then you can see the color straight away. Okay, not the one you've collected into nappies, not the one that has mixed with poo or all those kind of things. So urine is never thick, urine is never brown. Urine should be clear, colorless, at most light yellow color. If it's too deep yellow, so we are worried about it because that means it is concentrated urine and all that. Like if it's looking like limping, that is like concentrated urine. Okay, so that is how it should be. So if your baby's urine is not anything else apart from what I just said about clear, colorless, or light yellow, that is not normal. And it should never be thick. There's nothing thick about urine. It should be like water and clear and nothing inside. It shouldn't have anything inside it at all. So that is what we expect. You say your baby takes pap, but it's also exclusively breastfed. Those are contradictory information. Okay, a baby who is exclusive breastfed cannot be taking pap. So of course, but I don't expect your 6 months old to be on exclusive breastfeeding. After 6 months, you can start complementary feeding. So I guess you meant your baby is breastfeeding, and it's very important. It's a very easy mistake that mothers make all the time. Exclusive breastfeeding is not breastfeeding. A lot of mothers get it wrong because I've seen people ask me, "Oh, my baby is exclusive breastfed, but I'm giving water." You are not exclusive breastfeeding. That is breastfeeding, but you are giving water. Okay. When we use the word exclusive breastfeeding, it means there's nothing else you are giving that baby except breast milk. That is the meaning of the word exclusive breastfeeding. Okay, so this baby is not on exclusive breastfeeding, which is normal because it's now over 6 months old. and it's taking complementary feeds. So the baby is still breastfeeding and taking complementary feeds, but we can't say the child is being exclusively breastfed. So I just want to correct that, because a lot of people misunderstand the word exclusive breastfeeding and they tend to use it for breastfeeding. They are not the same thing. You can be breastfeeding and not be breastfeeding exclusively. Okay, and a lot of Nigerian mothers actually breastfeed, but we don't do a lot of exclusive breastfeeding, because we give water, we give formula and all that. Exclusive breastfeeding is just breast milk, no water, nothing else, not even drugs that a doctor has not recommended. That is what exclusive breastfeeding is. Okay. And also, your second question, is it wrong to add age appropriate formula milk to baby's pap? It is not wrong. You can add formula to your baby's pap. Okay. I know you people have seen a lot of social media videos that I'm always surprised that the wrong information always go viral and the right information don't. I don't know why. It's just a weird word that people will spread wrong information. And I guess because people tend to get shocked and react to that. So I think a lot of people sent me that video. Somebody saying, okay, if you had milk to baby's pap, your baby will have interception. That is not true. Okay, that is not true. And like I said, and I've said this before, when people make statements, you must ask the authority behind what they say. Even me, all the things I said, like all that I've said to you about, you can fact check it. You can go and ask ChatGPT. You can go to WHO website. You can go to uh uh which other one? American Academy of Pediatrics. There are standard bodies. There are people that can only say things that you don't question. Not a random person coming on social media and saying something and everybody goes with it. No. And the person didn't even quote any scientific evidence, he didn't quote anything, and just said this, and everybody starts having palpitation and everybody starts sending me videos up and down. No, don't just say what people say, okay? And I don't care whether they say they are doctors or nurses. I've seen people say all sorts of nonsense who claim to be professionals on social media, and you automatically some of them are not professionals. Okay, and of course we all know there are fake doctors. Every time they're always busting people, even in advanced country like US, UK. People have been, but I think recently I was reading yesterday about a so-called dietitian who was picked up in the NHS, who doesn't even know where the intestine, who doesn't even know this. And that kind of a person can also come to social media and say, I'm a dietitian, I work with the NHS and and the person is going to mislead a lot of people. And social media is not regulated. It's not like professional bodies. Social media is not regulated. Anybody can come to social media and claim to be anything and say anything, okay? But it is your responsibility to know who you listen to. Unfortunately, that is how it is. Actually, when you are taking, and that is why even on our Facebook group, you see we have what we call disclaimer policy. You can't hold us responsible for information we share and all that, okay? There's always a disclaimer policy, and whether you like it or not, that is the truth. So your only person that you can hold responsible is your own doctor. If they tell you to do something and you went wrong, then you can go back to them. But you listen to somebody on social media, they mislead you, you can't sue them to court. You are the one that decides to go and listen to them. Okay. So make sure you are also taking information responsibly. Fact check information. Oh, Dr. Bimi said we should only do exclusive breastfeeding for 6 months. Is it true? Go and hack this on. What did WHO say about it? What did the NHS said about it? What does this person? I mean, what does what's it called? American Academy of Pediatrics say about? These are standard bodies of professionals and not one person. So whatever they say, that is the fact of the matter at that time. So all this issue about adding formula or bread or milk to pap, it is not in any professional anywhere that is wrong. Okay. And so only one Nigerian doctor come on social media one day, I don't know whether it's Facebook or TikTok, and said that and created a lot of panic for Nigerian mothers. It's absolute nonsense. Okay. But like I told you, nobody even check whether this person is a doctor. Okay, to start with, because nobody say this is the hospital where you practice, or because he said it doesn't mean it's true. So please always fact check information. That is your responsibility. That is your responsibility. and don't just fall for whatever anybody says. Fact check information. There is an association of dietitian, nutritionists in Nigeria, in UK, in US. Those are the places where you should go for those kind of information, not because somebody has said something on social media. So I hope that is good. So it is okay to give a baby pap, and if you want to add milk to it, you can add milk. You can add your breast milk. You can add any other age appropriate formula. Okay, let's move on because of time. Happiness is saying, I was asked to get amoxiclav as his prescription after seeing a pediatrician, but the pharmacist said they don't have it. Can we use Fleming for it? Is it okay, man? Okay, so now when we talk about drugs, there's what we call the generic name of the drugs, and there's what we call brand name of the drugs. Okay, let me give you an example. Paracetamol. Everybody knows paracetamol. Now, paracetamol is the generic name of that drug, but there is MSO paracetamol, there's MCAP, there is what's the other ones? What are the other brands of paracetamol? They all went off my brain now. But what I'm trying to say, you have different paracetamol. There is Panda, and there is all sorts of brands. Even in US, they call it Tylenol and all those kind of things. So Tylenol is just a brand name of paracetamol, okay? So different drug companies will call it a different name, but the original content is the same paracetamol. So that's exactly what you're doing with amoxiclav now. So it is amoxicillin clavulanic acid. That is the generic name of that drug, but we have different brand. So amoxiclav is a brand. Okay, this one you're calling amoxiclav is a brand. Fleming is another brand. Augmentin is another brand. They are all the same brand of the same medication, that is amoxicillin clavulanic acid. Okay. Ideally, in an ideal world, doctors were supposed to prescribe generic names of our drugs. So if I want you to take paracetamol, I should write paracetamol. I shouldn't write MCAP. I shouldn't write Panda or whatever. Okay. So that when you get to the pharmacist can now decide to give you any of the brands that they have. Okay, but some doctors like to prescribe by the particular brand for many reasons, because actually in a country like Nigeria, we know that there are some companies that are their brand is not genuine or reliable or authentic, so we can't rely on them. So because of that, people like to prescribe brand. So some example, Ampiclos is an example. So I prefer Welcome Ampiclos, but there's also Jawa Claus, there's also other ones. But because doctors have used a particular brand and they found it to be reliable brand, so they tend to prescribe that particular brand. And of course, price is also another issue. Some brand are, even though it's the same drug inside, some brand are more expensive than another particular brand. Okay, like if it's a brand that is imported from India, it may be cheaper than a brand made by, let's say, a local pharmacy like MSO or what are the name of these other pharmacies that we have, Sky, SKG Pharma, and all the rest of them. Okay, so that is why some doctors prescribe specific brands. Now, if your doctor has prescribed a specific brand for you and you went to the pharmacy and they don't have, the person to answer the question whether you can buy another brand is that doctor, not anybody else. Okay, because I don't know why. I can give you a generic answer and say, oh, it's the same drug. Is Fleming, amoxiclav, Augmentin, they are the same drug inside. The pharmacist can also do that and just give you that. But because your doctor has specifically asked for a particular brand, we cannot change his prescription without his permission. So ideally, what your pharmacist should have done is to call your doctor and say, I don't have this brand that you prescribe. Can I give this other brand that is available? And if that doctor um doesn't have any issues with the brand, then they can give it to your child. So personally, I don't have any issue with any of those brands. But like I said, I'm not your doctor. I'm not sure why your doctor has prescribed that particular brand. So I cannot say yes or no. I've only given you the understanding of what is going on here, that it's still the same drug inside. So excuse me, just a different brand. So it's up to you and your doctor to decide whether you are happy with a different brand. But I am not uh, ethically allowed to change another doctor's prescription. Yeah, because I don't hold any responsibility towards you. I don't have any contract with you. Your contract is with that doctor and the pharmacist, not us. So we are not the ones to be telling you what to do. It is the doctor that you pay the consultation fee to, who has the contract, health contract with you. Whether you sign it or not, there's a contract between you and the doctor, and it is that doctor that will say, "This is what I want. Why did you change it?" Because if anything went wrong, let's say, God forbid, the child reacted to the, is can be a major issue. So, which is, for example, why you never self-prescribe medication on ATP. There are ethical principles behind all these decisions we take. So I would say you or your pharmacist should call the doctor and find out whether he is happy or she is happy for you to take another brand. And if your doctor is happy, why not? Just go for it. Okay, I think let's move on. Happiness, is this the same happiness? Yes, you're asking what's the normal weight for a 1 year, 6 months old. An average, know the keyword average. An average 18 months old should weigh 11 kilos. That is average. And when we use the word average, it means 50% of children, that is their weight. Some will weigh a little bit higher, some weigh a little bit lower. Between 80 to 120% of that average is still within normal. So for your 18-month-old, 11 kilos should be the average. It doesn't mean if that is weighing 12 kilos, we are worried. If that is weighing 10 kilos, we are worried. But averagely, it should be 11 kilos. Okay, yeah. So I think I've actually looked back. So maybe 6 months old, that is fine. And you started complementary feeding, that is fine. What was your question again? Yeah, you were the one asking about pap and all about the urine. Yeah, please just confirm that urine part is correct. Just check the urine. Urine should not have no other color. And I have a feeling maybe it's the stool mixed with the urine in the diaper. Sometimes mothers don't know how to differentiate the two. So you may have to collect the urine separately, because if it's in the diaper, they all mixed together, you won't know which one is coming from where. All right. Okay. Let's move on. I don't seem to have any question from Instagram people today. Or what's going on? Okay, but that's fine. Sometimes people don't have questions. All right. So I just want to, while I'm having a break in the question and answer, this is a new Nigerian program schedule, Nigerian program on immunization schedule, and ever since we posted it, I've had so many questions. It's just a few changes that have been added. They've introduced the malaria vaccine, okay, at 5 months. But please note that the malaria vaccine is just being rolled out. That's why you see so many stars, about 2 stars on it, and it's just being rolled out for now, and it's not yet available in all the states. So because a lot of people are asking me, oh, my baby didn't take the 5 month vaccine, my baby didn't take 5 month vaccine. Your baby cannot yet take the 5 month vaccine. It is just been added, and it is currently available only in Kebbi and Bayelsa states. So those are the only 2 states. If you are in Kebbi and you're in Bayelsa, you will have malaria vaccine at 5 months. But every other person, we don't yet have malaria vaccine. So don't stress your health center, don't stress anybody. Where's malaria vaccine? Where's malaria vaccine? It is not yet universal in the country. That is how we normally do vaccines. When we're introducing something new, we do it in what we call phases. We first give it in a particular place, we monitor for side effects, we do all this, we do that. If we are comfortable that it is really working, it's not causing any harm, it's not causing any problem, then we can begin to increase the states. But just relax. Even that is also for those who remember when we started the roadside, it was exactly the same thing. And the same thing with when we started the pneumococcal vaccines was exactly the same. That's how we normally do vaccines. So, but over time, it will get to everybody. It will reach everybody's turn. So for now, only Bayelsa and Kebbi as malaria vaccine. So just to clarify that. Another change that has been added is the malaria vaccines is going to be about 3 of them, 3 doses at 5 months, 6 months, and at 7 months for the malaria vaccine. Okay, but it is not yet universal. Another thing that has been added is um the vitamin A. Now they've made it 6 months and 9 months. Instead, before we used to give it 6 months every 6 months until the age of 5 years, but now they've kind of modified it a bit. Strictly speaking, vitamin A is not a vaccine, is a nutritional supplement. But because I think the challenge is that most parents don't come to us at 1 year, because they don't come to us at 1 year. So we tend to miss out on those children getting their second dose of vitamin A. So I think that is why they are bringing it back to 9 months old. Okay, that's about vitamin A. Then our measles vaccine has now been replaced with measles rubella vaccine. So previously we used to have measles only at 9 months and measles 2 at 15 months. But now the measles is now MR. It's now measles rubella. Hopefully one day we'll get to MMR, but right now we have MR. So measles and rubella. That is our new vaccine that will give at 9 months, and the second dose will be given at 15 months. So there's no more measles vaccine. It is measles rubella vaccine. MR1 at 9 months and MR2 at 15 months. And then the HPV vaccine, human papilloma virus vaccine, is available at 9 years, and it's for both boys and girls. So I don't know why we always think it's only girls. Actually, boys can also of course girls are the most important ones, because if cervical cancer, but in some countries they give boys as well, but girls are the ones that we are most worried about. So I just decided to bring out the updates on the vaccine. It's available on our website, on our Facebook groups, and if you have any questions about it, feel free to ask. But we'll just keep on highlighting the updates for you. Like I told you, we always keep you updated on any changes as far as vaccines is concerned. Okay. I hope everybody gets the updates on the vaccine. Okay. All right. I don't seem to have any more questions, and my time seems to be running out. I got 2 more minutes. But just to let you know that even after the live section is over, you can ask questions still. If you have any question, if you are just joining us, you're welcome. If you are coming towards the end of the show, that is fine. You can rewatch the video from the beginning, and you may still learn from the questions that other people have asked. Somebody may have actually asked your own question as well, so that's fine. But if after you've watched the video we've not answered your questions, or you still have more questions, feel free to post that question to us on our Facebook groups. We have about 4 Facebook groups. We have Ask the Pediatrician Facebook group. That is the main group for children health issues. We have ATP Family for adult health issues. We have ATP Still a Mom, and we also have First Time Mom group as well. So feel free to post your questions on the relevant group. Please post adult issues on ATP Family, post children health issues on Ask the Pediatrician ATP Facebook group, so that we won't have to say no and redirect to. We are very particular about where the questions are posted. And of course, you can watch all our videos, our reels. We're on TikTok, we're on YouTube. You can see all the various link on behind me, our email address as well. If there's any topic you want us to address, we are on Instagram, we're on YouTube, we have our website www.askpediatricians.com. We're on Twitter, so follow us everywhere, learn from us. We are here to support you. Our goal is to make sure that no child dies from preventable conditions. That is what we want to do, really. We want to make sure no child dies from things that we can treat and from things that we can prevent. And that is what we do online and offline. Thank you so much, everyone, for joining me today. Have a wonderful, wonderful rest of your day. And hopefully, we'll catch you in our Facebook group. If you still have any questions, remember what we said about the uh, vaccine updates. And you don't really need to do anything for now. Most of them, if your baby has mixed what has passed, don't go and stress them to take it. You can only go forward if you still have, if your babies are still young, they can still take some of these vaccines. I guess the only one that we can't give everybody now is the malaria vaccines. So I just want to highlight that. So thank you so much, everyone, and have a wonderful evening. And it is bye bye from me. Bye.